I'm William Burns. I'm a surgeon here at Johns Hopkins, and I specialize in treating patients with cancer, especially pancreas cancer and other cancers of the upper abdomen. I also do research on pancreatic cancer and the way in which we can get the immune system to treat this cancer more effectively. So I've been interested in patients with cancer for quite a while. It was something that started becoming a big interest of mine as I was a medical student. At that point, I saw a lot about how different types of cancer can impact patients and their families, and I saw the benefits of surgery as a technique in which we can remove cancers and extend people's lives. As I got into surgical training, it became even more powerful how much surgery can help as techniques advanced, and those types of surgeries became much safer. And so it became a passion of mine through that, and also just the interaction you have with the ability to cure patients with cancer. Patients with cancer have a lot of different stresses going on in their lives, and most of the patients that we see here have the ability to rely on friends and family members to help them through that difficult time. I'm very involved with patients' families so that we can meet and talk about how the cancer will impact the patients' lives, but also give them information about what to expect over the course of their treatment. Surgery is something that we're very familiar with because we do it every day and every week, but it's usually a bit of a mystery to patients and their family, and so a lot of the counseling takes place to figure out how the surgery is going to impact the patient's next several days, next several weeks, next several months, and even potentially next several years. And the patients' families are critical in understanding how that might play out. We work very closely with other cancer experts here at Johns Hopkins. We have the benefit of having world-class radiologists and pathologists to help us understand what stage the patient's cancer is, make sure we have the right diagnosis, but also world-class medical oncologists and radiation oncologists so we can figure out which treatments are most effective for each patient, and probably more importantly, which order to start them in. And so we work very closely every week to figure out the right personalized approach for each patient. My research focuses on harnessing the patient's immune system to fight cancer. We've seen over the last decade or so how immune-based therapies or ways to enhance the patient's immune system can help for a number of cancers. Mostly that has worked in some liquid-type tumors, melanoma, and some other select cancers. We've been trying to figure out ways to extend that to tumors of the gastrointestinal tract, liver, and pancreas. As a pancreatic cancer surgeon, I'm very interested in figuring out how we can modulate or impact the immune cells within pancreatic cancer to allow patients' immune system to recognize cancer as something that's foreign to them, much like it does an infection. We've started to learn that there are some cells that pancreas cancer has within it that help suppress the most important cancer-fighting cells in the immune system. And so my lab has been focusing on how to change the way those cells behave or eliminate those cells that are allowing the cancer to hide from the immune system.